John, the Newhart clinics are a full-service hair care facility. Will you explain the two divisions?
On one half is Complete Hair Shop, is where we do our hair system, our hair replacements, volumizers, haircut, body waves, and color. And it's all done in private rooms. And there's TVs and VCRs where you can pick a movie and sit back and relax.
What's on the medical side?
On the medical side, we have 4 certified doctors in medical rooms where we do our hair transplants and scalp reductions. And we also see our upjohn clients that use Rogaine. And also we have a room where we see our alopecia and chemotherapy patients.
Newhart also has a full line of hair care products.
We have a variety of excellent products, starting with our shampoo, conditioner, also our mousse, styling gel, and sprays the clients really enjoy.
John, I've heard a lot about a hair growing product called Rogaine. What is Rogaine?
Rogaine is a product from the Upjohn Company that will actually promote hair growth and prevent hair from falling out. Used correctly on a good candidate, it works extremely well.
So Newhart can meet any hair care need.
We feel we have bridged the medical and the non-medical hair care needs under one roof. Our clients have access to the doctors who are available and willing to answer all their questions. We feel that the merger of hair and the medical hair service is the way of the future.
Now, everyone loses a little hair every day. Under normal circumstances, the loss is too small to be noticeable, and hair grows back at the same rate at which it is lost. Baldness develops when hair is lost more quickly than it can grow back. This, of course, happens over a period of years and varies with each person. Rogaine is the first prescription medication proved effective in the treatment of male pattern baldness of the crown. It contains a topical solution of 2% minoxidil. Rogaine should be applied only to a normal, healthy scalp. If your scalp is sunburned or inflamed, contact your doctor before applying the solution. There are some important things for you to know about Rogaine before you start treatment. Rogaine is not a panacea or a cure for baldness. It is a treatment. There is no evidence that Rogaine causes hair regrowth on the front of the scalp. And Rogaine does not work for everybody. It has worked for some people, and it may work for you. Another point. Successful treatment with Rogaine requires a commitment on your part. Since you didn't lose your hair overnight, you can't expect rapid regrowth. To find out if Rogaine will work for you, be prepared to make a long-term commitment to treatment. We're now going to show you some of the results of studies in which doctors evaluated Rogaine. Clinical trials were conducted in many medical centers and involved over 2,300 patients with balding on the crown of the head. Some patients were treated with Rogaine, and some received a placebo, the same solution without minoxidil. Hair regrowth was determined by actually counting hairs. It's important to understand that successful treatment with Rogaine requires a long-term commitment to sustain hair regrowth. After the non-placebo controlled continuation phase, from month 4 to month 12, physicians reported the following: no growth, new vellus, minimal regrowth, moderate regrowth, and dense regrowth. Certain characteristics favored regrowth. Age, for example. You stand a better chance if you're younger, or if you've been balding for less than 10 years, or if your balding area is less than 4 inches in diameter. You should understand that these are only trends, and that hair regrowth was observed among all groups of patients with male pattern baldness of the crown, regardless of age, duration of baldness, or size of the balding area. Before you start therapy with Rogaine, there are some important things you should know. It is essential to make a commitment to continue therapy for 4 months or longer, because it takes at least that long for results to be seen. As this illustration shows, your regrowth may at first be invisible to the naked eye, but your doctor may notice soft baby hair, which is an encouraging sign. Then, if you continue to make progress, you might see a thickening at the edges of the balding area and a gradual filling in of the area from the outside toward the center of your scalp. If you continue to respond well to treatment, the new hair should become the same color and thickness as the other hairs on your head. Your prescription for Rogaine comes with an easy-to-understand instruction booklet that shows you how to use Rogaine. The booklet also advises you to apply Rogaine only to a dry scalp. You will also receive 3 separate complementary disposable applicators in each package. There's a spray for easy application to large balding areas. 6 pumps give you the measured dose necessary. Rogaine goes on as a clear, non-greasy liquid. There's a rub-on applicator for both large and small balding areas. 1 squeeze from the bottle fills the applicator with the correct dosage. And in the same package, there's an extended spray nozzle for application to small balding areas or areas already covered with some hair. Again, 6 pumps give you the correct dosage. 3 different complementary disposable applicators in each package to make sure you can apply Rogaine in the easiest way for your particular type of baldness. Instructions call for 2 applications every day, 1 in the morning and 1 at night. Studies show that the most satisfactory results will be obtained by following these directions. So don't be tempted to use more or less Rogaine than directed. And don't apply it more frequently than twice a day in the hope that it will work faster. Your prescription should last for 30 days. As you near the end of your supply, plan to renew the prescription to avoid missing your daily applications. Rogaine is for topical use only. It is to be applied only to a normal, healthy scalp. It should be used as directed, twice a day, every day. Rogaine is the first prescription medication proved effective in the treatment of male pattern baldness of the crown, and that's encouraging news.
Well, people who are bald or balding need not live that way, and men especially are very conscious of the way they look when the hair starts to fade away. Our guest this afternoon is John Gagliardano, and he is president of the New Hair Clinics and the Newhart Hair Clinic.
Newhart Hair Clinic.
And he is our guest. Give him a warm welcome, please.
Thank you.
I was trying to come up with a new name, New Hair Clinics, Newhart Hair
Newhart
Clinics.
Hair Clinics.
Let me ask you this.
Sure.
We see a man walking down the street.
Okay.
He's got a wig on, a toupee, a rug, a hairpiece, all the names for it.
Right.
You can always tell. Why is that?
We get the credit. One bad hair replacement may take the place of 1,000 bad transmission jobs, 500 custom suits. The reason why is, how do you cover up a bad hairpiece walking down the street? Everybody sees it, and I get that credit for the bad ones. The good ones go by unnoticed. You wouldn't be able to spot a good hair replacement. That's the saying we have in the business. You shouldn't be able to spot one. But unfortunately, you'll see guys who's walking down with lots of hair, different color hair. They don't even realize it themselves that the hair replacement's not fitting them today.
Yeah.
It's not the right amount of hair that they should have for themselves.
But what makes one good and one bad? Is it the bad ones are just the cheap one? I mean, I see
Not only
wigs you can
cheap,
go down
no,
and
no.
buy and just slap them on your head.
Right. No, what makes them bad is they go to a lot of people who truthfully don't want to can be honest with the client back. The client will say, he'll bring in his graduation picture and say, I want to look like this. He's 45 years old today. You can't do it. It's just not realistically to put 2 pounds of hair in a guy and let him walk outside at 45 years old. Or give him a style that he may have worn in the 1950s. What I try to tell people is let me do my job and get it down to a small amount of hair.
Now, I call them hair pieces, wigs, toupees. You call them hair
replacement. There's a difference. Okay, the toupee is a thing in the old where a guy just slept on his head and covered up a bald spot, covered up an area. This is ginger ale.
Welcome. Thank you.
Now, go ahead.
You have some. You have one on there, huh?
Yes.
Now, can you honestly tell that that's a hairpiece?
Now, Gene's been wearing it for 15 years. A lot of people feel, am I less of a man? How do I tell a woman that I have a hair replacement on? Gene himself just got married, 2 years ago. You ran into the same problem with your wife. Did you feel uncomfortable first when she found out you found hair?
No, I just told her, and her reaction, she would have never knew. And I find out most women are sensitive to the subject, and they feel a man should look his best.
Now, you can take yours on and off.
I can if I wish to.
Can you swim in that?
I can
take a shower in
swim,
it?
I play a lot of racquetball. very active as far as athletics.
Okay, now he's not completely bald. He's got hair on the sides, right?
Right.
And he has some hair on the front.
Right.
Do you incorporate that into his hairstyle?
Yeah.
Or do you just...
I use every hair on a man's head. I try never to shave a man. Use every hair that he has to your advantage. Again, some of the things that you have to realize is you have to take in consideration, let the man do his job. Gene, this looks like Gene today, the way you look.
Okay.
Doesn't mean that 10 years from now, Gene should be wearing a sock.
I gotta ask you this question.
Okay.
All right, now, they're water-flooding, you can swim in them and the whole thing, and you forget you have it on probably most of the time because you're wearing it all the time.
Correct.
What happens when, maybe he's in bed or something and she starts putting her hands...
That's what most men worry about. This is the truth. I'm glad you asked that seriously. They don't realize that women are brought up to cosmetic items. No, this is the truth. So most men fear that. This is like a big fear inside them. They don't understand it. But women understand cosmetic items. They're naturally prone to it. They admire a man who wants to enhance himself. So, again, Gene ran into the same situation with his missus, and I don't think you found any problem, did you? You just never straight up?
I mean, it's hair, and it feels like hair. As far as...
None of this.
Don't touch my hair. Don't anything but my hair.
We used to do that in the 50s.
John, thank you very much for being on the show this afternoon.
Thank you very much.
Thank you also, okay? Stay tuned. We'll have new...
Well, we have the microblend hair system. This is the perfect solution for a guy who's completely bald and wants a full head of hair. Some fellows are just not good candidates for a hair transplant, or for whatever reason, go with the Newhart hair system. But they understand they are wearing something on their head. I have thousands of clients that have our microblend hair system and are totally happy.
John, I was recently in your Pittsburgh office, and I had the opportunity to meet some of your hair system clients, and I was amazed at how wonderful they looked. I would not have known they were wearing a hair system had they not told me. Their hair looked very natural. It was light and airy.
It really is light and airy, and it can be done gradually. I feel anybody can make their hair look good in an air-conditioned or heated room. I'm more concerned about how my clients look when their hair is windblown, wet, and messy. I like my clients can come in out of the wind, hand comb their hair, and their hair looks great.
Yet recently, I understand that you've been getting a lot of calls from guys who are concerned about the hair system and if they have to shave their head, or if they have hair, can they pull it through the hair system?
Kelly, we have heard and seen from a lot of guys, and when they get their hair system, they have been shaved, and they didn't even realize it, that when they got shaved, that this is a lifetime commitment as long as they're wearing their hair system. So I have a real hard time with that. Before I shave a guy, we have to sit down and talk because he has to understand this is a very big commitment. Second of all, when you pull the hair through this hair system, it just doesn't work because the hair doesn't stay pulled through. One or two shires, the hair that you pull through will invert back down through those holes, and then it's piled up underneath the hair system. So you have to watch that too.
When I came in for consultation, we discussed the three different options: hair transplants, Rogaine, and the hair systems. And then we decided from there what would be the best program for myself. 6 years ago, I had no hair. Now I have hair. I recommend it to anyone.
They showed me what kind of work they did, what they could do for me. They made it so easy that I made a decision right then and there to do something about my hair loss problem. My decision to go in for a free consultation was probably the best thing I ever did for myself. My self-esteem is up, the girls are looking again, and even in business, I find a self-confidence that I was lacking before.
A hair system is very personal, and I've brought it out in my professional life to let everyone know that it's easy. It's easy to do, easy to maintain, and it's worth every penny. The thing that may be hard to believe, it's true. It really is true. It adds to your confidence.
John also talks about his hair systems with some fellow racers.
Now, this is a meeting of only males, and males in a meeting are not going to get into cosmetics, but the interest was there because there are people that have thinning hair. They're wondering, what do I do, and how does this stuff work? Is it hard to maintain? You had 16 of the fastest powerboat drivers in the world. And we're talking about hair systems because it's important to everyone. If somebody goes to a gym to work out, they're trying to keep their body, they're trying to get their body in shape. So what's wrong with getting your appearance in shape? Look how good he looks. And if it happens to me, I can do that too.
Yeah, Amos, besides being a client, he's a very special friend too. He's a tremendous man, so I can say I can't wait to see him myself. Amos, it's good to see you, Amos.
You look great. Oh, it's wonderful.
It does, Amos. Amos, he's a tremendous man. He's an entrepreneur. He has his own businesses.
You look like a movie star.
Oh, come on.
Wait till David Letterman sees you now.
Oh, wow, he won't recognize me
I
now.
know.
What do you feel, Amos?
I feel good. I like it. I really do. You become what you look like. If you're old and gray and bald, you start to act that way. And I had no idea that it was going to come out like this, but I really like it, and I thank you and your staff so much.
It's wonderful. He's a beautiful man. Okay, you take care.
Thank you. Now, to explain some of the medical details of a hair transplant, we have Dr. Louis Serto, board-certified surgeon and member of the Newhart Clinic staff. Dr. Serto?
Dr. Serto.
Nice to meet you.
I appreciate you taking some of your time. Dr. Serto, today we use the mini, micros, and split grafts. The difference between today's grafts versus the old plug method. If you can explain that just a little bit to the audience.
Sure. The type of grafts that we use today are really the split mini grafts. And what that is basically a plug of tissue that we split in half and use as a graft. We found that the results with that type of grafting is far superior to the older technique using plugs.
Okay, and there's no skin taken out with the new way of doing it versus the old days where they took a plug out here, took a plug of skin out, and put this plug in. That's not...
That's correct, John. Basically what we're doing is we're removing a portion of tissue, trimming it up, using it as a graft, and making a small incision in the scalp where we place the graft. And it's just a small slit that we make.
Okay.
You know, Dr. Serto, I have a question for you. I understand that when a hair transplant recipient goes through this procedure, they have what's called a scalp reduction. What is that?
Not every patient that undergoes transplants will have scalp reductions. We use a scalp reduction as an initial procedure or a procedure down the road to reduce the amount of grafting that we need to do. This is important in patients who have limited donor sites.
Okay.
And it really works out quite well.
Okay.
With the split minis, and I hear you say this nowadays, patients that weren't good candidates years ago because of with that split graft are good candidates today. Is it because the hair, you can get the flow better across the head and stuff?
Yes, that's part of the reason, John. I mean, the aesthetics of the split mini grafts or using the split mini grafts are really far superior to the old plug technique. We find that with the split mini grafts, you don't have that plug appearance or that baby doll or cornrow appearance.
Nowadays, we've been seeing a lot of women come in thin, too, who's been getting transplants. Any difference there?
Basically, the procedure is a little bit different in that the planning is a little bit different. But as far as the essentials of the procedure, they're the same.
And the results are just as good as a man's? Okay. Afterwards, as far as recuperation time, this is an outpatient thing?
Exactly. This is an outpatient procedure done with local anesthesia. Patients come in, the procedure takes about an hour to an hour and a half, sometimes 2 hours, again, depending on the number of grafts. Patients are able to go home. A lot of people are able to go home, go back to work actually the next morning.
We have a lot of clients that are able to do that too. And I hear you say every once in a while about the we see these patients that's been coming in that had all just micros done, which means like 1 hair or 2 hairs at a time. You need the split grafts too, which gives volume along with that.
Exactly.
You just can't do one, right?
Exactly. You could do literally thousands upon thousands of grafts with just single or 2 hairs per graft. And that doesn't give you the bulk or the density that you need. We found that the split mini grafts are really a nice compromise between the older plug and the micrograft.
So you need both.
Exactly.
You need the volume and the softness. Doc, I appreciate it. I know your time is very valuable, and I thank you very, very much for coming today.
Yes, thank you, Dr. Serto.
Take care.
Nice to meet you.
Thanks.
Joining us now to talk firsthand about transplants is Mike Saley. Please welcome Mike.
How you doing, Mike? Nice meeting you.
Hi, nice to meet you.
Mike, I remember back when we first met, you had a little thinning and balding problem. If you can just tell us how you felt back then and the difference the way it is now. Your own words.
Well, back then, I felt all right about myself, but losing my hair made me feel a little older and, you know, getting teased here and there. And
one nice thing about the hair transplants for you now, it's your own growing. It's there for a lifetime.
Right.
And I don't know, how old are you now?
I'm 30.
30. So chances are, the way it looks, you're going to keep the hair that you have, so you're pretty well in good shape. So as far as the investment for yourself, do you feel it was a good investment?
Oh, yeah, very much.
wasn't going to be the type to wear the hat all the time. I wouldn't go swimming because I hated coming out of the pool and your hair being, you know, messed up, especially thin right down the middle. No, I'll be going swimming again. Now I went back to the closed-top cars because I don't want my hair to be blowing around when you just didn't have that much in the front. So now I can go back to, if I'm going to buy a convertible, I can.
Let's take a look at John Bell before and after his hair transplant and listen to his comments about Newhart hair clinics.
I did hear about Newhart. I came in, I liked what I saw, I liked what I heard, and I liked the idea of having hair again. Staff at Newhart is great. You know, they make you feel good right from the start when you come in. They make you feel good. You feel part of the Newhart family. It's an investment, but so are a lot of things. This is an investment that I've had for 9 or 10 years, and I'll have forever. Every once in a while in the shower in the morning, it's a treat. You don't realize sometimes is a treat, and you be lathering up, and you think about the times when you didn't have quite that much hair to shampoo and to work with, and it may sound silly to somebody with a full head of hair, but for those people that are sort of shampooing like this and maybe buffing a little bit, it's a treat. It's like most wives will say to their husbands, and what most husbands say to their wives, you know, I'm going to love you however you are. You know, I don't really care. But they're not looking at what you're looking at. And you know, I did it because I didn't like the way my hair looked.
John, we interviewed one of your clients who was a pilot for a major airline, Larry Munn.
He likes to be called Chip.
Okay, Chip had a layover at the airport, so we went out and got these comments.
I became fully bald at a very young age and very concerned of my appearance. So I examined the options available to me, and I chose the transplantation procedure.
Let's hear Chip's thoughts about his investment.
A car you use in 3 years, or you get most of your use out of it in 3 years. But with a hair transplant, you wear it 24 hours a day, every day of the year for the rest of your life. It's the best investment I've ever made in my life.
Can we briefly walk through a hair transplant?
Let me explain this to you as it would be a client sitting in front of me. Hair transplants is where we take the hair from back here, we transplant to the thinning and balding area. Where we take it from back here, we suture that together, so you lose no density at all back there. I actually have clients who feel their hair grew back here, but it can't because it's now up here. When we put it up here, you may or may not have to wear a bandage out overnight. If you do, we take the bandages off the next day, shampoo you, you're off and running. I tell clients, give yourself about 6 months for your hair to be an inch or longer, and it'll grow the rest of your life. And let me just touch on it just a little bit. The reason why it grows the rest of your life is it takes the genetics of this hair, and it's now up here. We know that transplants is over 30 years old. It's a medical fact, so it'll continue to grow. It's about a 2.5 hour procedure, depending. You can localize with a local anesthetic. It's like a pinch. You can't relate it to pain. I've had it done. I'm no Rambo. Thousands of my clients had it. And again, you're watching a movie while it's being done. And when you're done again, you're as strong as you were before you started. And as far as time-wise as getting your hair back, John, how long did it take you to go from your thinning and balding to a full head of hair?
Myself, I was about a year.
About a year.
I had my hair to a stage where I could style it, come anywhere I want.
Just where it is today, okay.
There are people that can obviously have it sooner than that. It all depends on your own schedule because really you work it around your own schedule.
It's your schedule and also the amount you're getting done. And you use John as a gauge. His was under a little bit under a year. Yeah. Mine was probably, I got all the hair back I wanted in probably about 9 months.
Some of the additional questions people have been asking about hair transplants are: 1, does it work on women? And 2, after getting the hair transplant done, can you get regular haircuts and styles?
Kelly, you'd be surprised how common thinning and balding is for women. The planning is a little bit different, but the results are just the same. As far as getting haircuts, you can get haircuts anywhere you want. And as far as styles, you can get any style you want. We have clients that actually wear their hair straight back that had our split mini and micrographs.
I understand that you have some clients that had hair transplants done at other places and have now come to you for the Newhart mini and micrographs.
Yeah, there are. There's a lot of guys who spend a lot of money on the old plug method of transplants, and they're really shocked at what sometimes just one session of our splits, minis, and micros can do for them. It really gives them that soft and natural look, and it really enhances the front hairline for them.
Also, we do quite a few fellows who are just thinning, and with the split medium micros, unlike the old plug method where you had to take skin and hair out, we're able to make a slight incision and put the hair right in between the thinning hair that they have, like I had done myself, which just enhances all the hair that you have up there that's thin right now. And if we can take a look at my front hairline and see how well it's done.
Why doesn't everyone go with the split mini and micrographs? And why are Newhart split mini and micrographs so much different?
First, Kelly, with the split mini and micrographs, they're so much time consuming and so tedious. And you could probably do twice as many with the old plug method, but the results are night and day in my opinion. Second of all, what makes the Newhart split mini and micrographs so different is our doctors, the way they trim and bevel each and every graph, and then they place each and every graph separately by themselves.
And not only that, John, we have 4 board-certified doctors on our staff, 4 of the finest specialists in their field. And that's why we get 100% success ratio. And not only that, Kelly, in over 15 years, we've never even had a case of an infection.
Oh, that's impressive. It sounds as though anyone interested in getting a hair transplant should go with the split mini and micrographs.
I tell my clients, you only have this hair back here to give once. It's not like buying a car where you get several chances in a lifetime. So this has to be done correctly the first time. Make sure you get the best results.
That's right. Something as important as getting a hair transplant should not be like buying a car or leafing through the yellow pages. You want to get a qualified professional to do the job right.
Right, Kelly. To get a hairline like myself, or like John's, or like thousands of other of our clients, they realize the importance of who's doing the hair transplants. And they want the most experienced professional doctors. And they don't mind traveling to come to Newhart to have the work done.
You have talked to some clients that have taken advantage of this. And what have they told you?
Well, like they said, they've taken advantage of the air, flight, and hotel compensation program, and it's actually, in some cases, made it less expensive for them to come to Newhart to have the work done.
Yeah, Laura told me it's like a mini paid vacation for them. I tell clients, getting your hair back, this should be something fun for you and exciting. I have clients that are looking forward to doing this and finally having it done once and for all.
Yeah, I understand that you have a chart with the 7 stages of thinning and balding.
Yes, if we can put them up there so I can walk the clients through this and just picture where you should be in each and every one. Okay, on stages 1 and 2, if you're in that area, you're probably looking at about 1 session of hair transplants at a cost around $2,000. If you can put up 3 and 4, if you're 3 and 4, you'll notice the recession is back a little bit and there's a little thinning in the crown area. If you're in those stages, you're probably looking at 2 sessions at $2,000 per session. Now, and sometimes we can do both sessions at one time.
What if you're in stages 5 or 6?
If you're in stages 5 and 6, you'll see the recession is back further. You'll see that the crown, there's a lot more hair lost. In those 2 stages there, you're probably looking at 3 sessions of hair transplants, again, at a cost of $2,000 per session. Now, if you're in stage 7, we sometimes recommend a scalp reduction with 4 sessions of hair transplants, again, at $2,000 per session. Now, in some cases, you cannot get that crown totally thick as you would want it to be. It would depend on some different factors.
Right. You can't, everyone can't get in stage 7, can't get their crown as thick maybe as they'd like to do, but every case is different.
And the reason why, some of the variables, John?
Well, the most important variable is what your expectations are. Oftentimes, someone that is a stage 7 would be happy with 1 or 2 sessions just to break up the
that harsh baldness has some time to do that.
The harsh baldness.
Plus, some of the other variables are your donor area, how dense and thick your hair is back here, and how curly or straight your hair is back here.
And these are different things that determine whether you need or don't need an extra session.
An extra session.
In what stage of balding would someone use Rogaine?
Like myself, I have clients like in stages 2, 3, and 4. Once they got the split mini and micrographs to bring them back where they want to be, they use it as a maintenance program to keep the hair that they had. Like I use it around 3, 4 nights a week right before I go to bed, and it helps me keep the hair that I had, and the split mini and micros got me back to where I want to be. Works perfect.
So many clients have been thrilled with your airfare hotel compensation program. This is allowing men and women from all over the world to come in and get the procedure done. I had one man tell me that he had seen the show and he had dreamed of coming in and getting a hair transplant. And with the program, Newhart has allowed his dream to come true.
That's nice to hear. It's always a pleasure to see happy endings like that.
Michelle came until she was very, very thin. Actually, you can almost see her scalp. She used a lot of products, gels, mousses, and everything, trying to cover it up. The volumizer just worked beautiful for her. It just gave her all the volume she needed.
So she found the volumizers to be her solution.
The best thing.
My self-confidence has improved already. Yeah, I came to Newhart Hair Clinic because I heard that they were a very professional staff and people who were very good with someone such as myself. I'm always on the go. I barely have time to breathe. I call my house my hotel suite because I'm so busy. And they are very good. I needed a haircut that I could run into the house, change, get it fixed in 5 minutes and be on the go again. And Newhart has been able to do that for me. And in addition to that, when you're on the go so much, you like to be working with people who are pleasant to be around, very personable and easy to get along with. When I go over to Newhart, they are that way. They're very easy to get along with. They're even happy, so it makes it nice. I've always been a blonde, and my hair, as I've gotten older, has started to get dark, as all of us blondes seem to find. So they were able to color my hair just so that I didn't feel like a bleached blonde.
Cost for all three options of the hair replacement.
Yeah, this is where we're getting thousands of calls from and everything. And if I can just explain this and everybody can just put themselves in what position they want to be in. All right, first of all, there's the FDA-approved Rogaine. Let's use 20 years for a number. Rogaine costs roughly, if you're going to use it twice a day on a regular basis all those years, you're looking at maybe around $600 a year. Over 20 years, you're looking at $12,000. And that's okay if that's what you want to use. All right?
What about the hair system?
All right, second, the hair system. A hair system. One of the big things people say, I see bad hair systems and that out there, one of the big reasons, too, is people wear them past their time. A hair system will wear out in about 1.5 to 2 years. It depends. Some people wear them permanently quicker. So you have to buy a new one about every 2 years. Cost-wise, you're looking at around $1,000 to $3,500. Let's just use 1,000, 20 years. Every 2 years, that's $10,000, right? Let's use a couple $100 service a year on it. Over a period of 20 years, that's another $4,000, $14,000 you have tied up in 20 years of a hair system. And again, I have thousands of clients that are tickled to death with them, but they know they're long-term. Because if you don't buy a new one every couple of years, they start to wind down. They start to wear out. They don't look good. All right. The last.
So you have $12,000 in Rogaine over a 20-year period, $14,000 in the hair systems over a 20-year period. What about transplants?
Okay, transplants, especially now with the split mini micros, they're so popular. Cost ranges $2,000, let's say to $8,000, varies. Okay, what makes it vary? Of course, the amount of area you're doing, and then second of all, how thick do you want it to be for you? For instance, myself, I had hair transplants done. I could probably get another session if I wanted to and make it thicker if I wanted to. But I'm totally happy with what I have right now. As I tell my clients, it's your eyes to the mirror that got you here. They said, geez, I'm a little bit thin, I want something done. It'll be your eyes to the mirror that you're thick enough again. And you do it in steps. It doesn't have to be done all at once with the hair
transplant. So it's left up
transplants.
to the person. It's relative to what the person wants.
Sure. And with the split mini and micros nowadays versus the old cornrow effect as we talked earlier, you get that real soft, fine hairline. And that's most important. Like my own hairline that I'm going to be showing you. You can see that you can't tell. There's no scarring, there's no round circle up there. So again, like we're booked 5-6 days a week on a steady basis doing them. So they're very
let's talk about it over a lifetime. So if we were to say $12,000 for the Rogaine, $14,000 for the hair system, and over a lifetime, would you say that the hair transplants would be the least expensive?
Well, there's no question about it, only for some reason it's a fact. That it's once done, it's over with, and on top of it all, it's your own growing head of hair. Now, neither one of them is a bad figure if you compare it to a car that you're going to maybe buy $15,000 for, and it's going in 3 to 5 years. And this is something that aesthetically is going to enhance you 7 days a week, constantly. So neither one is bad, but if you're saying what is the best buy and what is the best
what's the most
situation,
economical, so to speak?
with the hair transplants nowadays, with the split minis and micros and everything, I can't tell you how swamped we are. And I had many thousands of hair system clients call me from around the United States saying, you know, can I wear my hair system while it's being done?
Would you recommend a hair transplant to everyone?
Not to everyone. You can't do nothing's for everyone because you have to, number one, be a good candidate. Your expectations on what you want have to be real for each one. But on the other hand, there are certain guys out there that you can't give a hair system to. They won't wear it. I mean, you could give it to them and they would just throw it away. They don't want to wear something on their head. And for those fellows with the new split mini and micrographs, I tell them, to me, it's one of the biggest major breakthroughs in the hair industry that I've been in 30 years.
Okay, John, we have a person now who is very interested and wants more information about the clinic. What would you tell him to do? Should he call? What's his next step?
Okay, a couple of ways. There's 2 ways of doing it. Real quick, if I just can run through them. First of all, if you can send a picture of your top, front, and back, it doesn't matter how you get them taken, even though there's no photo booths, and send them to the Newhart Hair Clinics, the Fulton Building, 107 6th Street, Suite 1300, Pittsburgh, PA, 15222. And please put your name and phone number with them, and we'll get back to you. Now, what I found out, Kelly, is we have had thousands of calls from hair system wearers around the country.
Is a phone call okay?
Oh, a phone call is beautiful. Through describing their hair loss, because some of them wear it permanent, and some of them just having difficulty taking pictures, they're able to describe their situation to me, and I can go over a consultation and tell them a cost and so on and how many sessions. And they have already, many of them have already come in and already got their first session done, and their hair's growing. And I tell the hair system clients not to worry. We have a complete hair shop that we can take their hair off, get it serviced while they're being done. They put the hair back on when they leave. They're off and running again wherever they live around the United States or out of the United States, because we, as you know very well, we have a lot of people traveling internationally now. So either way, it works great. Just give us a call and we'll be able to help you right along. The directions to the Newhart Clinics, first of all, the one downtown, we're about 20 minutes from the airport. We're right across from the Three Rivers Stadium. Downtown, for those of you who know that area, we're right down from Heinz Hall.
Right down the street from Heinz Hall, about a block over from Horns.
Joseph Horns. We're right on 6th Street, which is right across the 6th Street Bridge. Very easy to find. And if you need additional information, directions on how to get to us, call, and any one of our staff will be able to help you. Now in Johnstown, John.
In Johnstown, it's again very easy to get to us. We're located right off of 219, the Elton exit.
Okay.
We are located in the College Park Plaza, which is right across the street from the Richland Mall.
Okay.
So again, if you're having any problems at all, give us a call. We'll guide you right in.
Yeah, and we also can send you, we have written directions too, if that helps you a little bit better. But give us a call and we'll get you to the office, no problem whatsoever.
Take control of your thinning and balding at Newhart Clinics. The answer is easy and affordable. Call now. We also have a convenient payment plan for those who want it.